Hi, everyone. I'm Carrie Fox. I'm the Director of Marketing here at Lakeview Health. And we are going to go ahead and get started. It is officially noon. We have a very exciting webinar ahead, so I want to make sure that Philip gets as much time as he can to present on this topic. So just a little bit about Lakeview Health prior to having Philip get started on his presentation. Lakeview Health is a multi-site adult dual diagnosis treatment program, and we do have two locations. We have our flagship residential treatment center here in Jacksonville, Florida. We do gender-responsive treatment here, which simply means that men and women reside in separate facilities and have unique curriculum and programming that is tailored to their specific gender needs. We're ready to treat clients with dual diagnosis. We sit on a 12-acre campus, and the campus includes the two gender-responsive treatment facilities, a 10,000 square foot wellness center, and administration building and a conference center. We do believe in treating the whole person, and so the 10,000 square foot wellness center is really important. Patients have the opportunity to participate in wellness twice per day, and it really helps to fulfill that whole mind, body, and spirit healing that needs to happen with an addiction. We are Joint Commission accredited and hold the Recovery Residences certification. We are members of NAATP as well as National Association for Behavioral Health Care. And just a little bit of housekeeping. Questions, we welcome questions. You'll see in your side panel that there's a questions panel. Go ahead and put your questions in there. I'll moderate that at the end of the presentation. We do appreciate your feedback. So at the end of the webinar, an email will show up in your inbox that will include an evaluation as well as a post-test. If you could complete both of those for us, it would be really helpful. We love knowing what you thought about today's presentation as well as any type of topics that you think are going to be helpful for you and your practice in the future. And then I hope that you'll be able to join us for our upcoming webinars. We do have part 2 of personality disorders and addiction next month, and then we have a new chief medical officer who is starting with us, Lancy Durandy, and she will be doing our July webinar, and the topic is to be determined at this point, but please watch our inboxes for that. It's going to be really great regardless of what she does. She's got a lot of experience and credentials, so looking forward to that. All right, without further ado, Philip Warwick is with us today. He is our clinical manager at the STAR, which is our men's program. He has a master's from USF, counselor education, mental health counseling track. He's currently pursuing his MCAT, and he's been with Lakeview Health since 2016. His previous experience includes youth development, substance abuse, and current workplace. So without further ado, I'm going to have Philip join us and start talking about integrating self-help into therapy.
Thank you very much for the introduction, Carrie. So for the webinar today, what I was really wanting to do was kind of go back to the basics in a sense, but hopefully provide you all with some additional information about self-help and how closely a lot of these self-help programs follow a lot of the theoretical orientations that a lot of us are using in our clinical practices. So that's kind of the goal, the overall goal for today. And I'm going to try and go through everything at a moderate pace here so we have enough time to get to everything I want to cover. That being said, we will have time at the end for questions. And then even if we aren't able to get to all the questions today, I'll always be available to answer any follow-up questions just to make sure that everybody gets everything they need out of this. So we are going to start with just the definition and a brief history of self-help. I decided to throw in the history of self-help for a couple of reasons. One being it's interesting to kind of look back and see where the roots of self-help came from. But some of the first self-help that we see, which actually started pretty far in the past in ancient Egypt, it was just fascinating to me. And so I thought it would be interesting just to throw it in there and spend maybe a minute talking about it before we dive into the real content today. Then we'll explore some of the common self-help programs that exist out there, specifically the ones related to substance use disorders. So this will cover things like Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Celebrate Recovery, and we'll look at refuge recovery real briefly. We won't spend as much time on the refuge recovery, although I will say that they do have a very interesting program and a lot of resources available. Next, we'll look at understanding why self-help works, so looking at the benefits of self-help and what people can gain from engaging in self-help programs while in treatment and post-treatment as well. Then we'll get to the bulk of the discussion for today, which is integrating self-help into treatment. And I'll dive in obviously in more detail later on, but just to give a snapshot, for AA and NA, Celebrate Recovery, there's a whole lot of cognitive behavioral therapy that's taking place in those programs. And then in Smart Recovery, we'll look at REBT, Rational Emotive Behavioral Therapy, and how some of those techniques play into Smart Recovery's approach to self-help. And then at the very end, we will look at some of the obstacles and common stigmas attached to self-help. So this can be things like the religious component associated with some of the self-help groups like AA and NA and Celebrate Recovery, as well as some of the other stigmas that exist. And we'll have time, hopefully we'll have time to get through all those as we go through it. So let's start with just looking at what self-help programs actually are. Most of us probably know this, but they're also known as self-improvement programs. They are self-guided. That's the idea behind them. We seek to get guidance from the fellowship, but the work has to be on an individual basis. So we can get guidance from our fellowship or from our peers, but if we're not willing to put in the work, then the self-help programs are typically not going to be successful for that individual. There's pretty much a self-help program for everything. If you have an issue of any kind, you can find some kind of self-help program that exists out there for you. So it covers economical, intellectual, emotional. You can find financial self-help groups. Obviously, what we're going to be focusing on today, though, primarily is the substance use disorder self-help groups. And we'll see some overlap with especially Celebrate Recovery and Refuge Recovery in terms of the fact that they are welcoming all kinds of people with all kinds of different disorders, even like anger management, things like that are welcome to attend those groups. The goal of any self-help group is to have some sort of psychological basis behind it. And again, that's what we're going to kind of look at today, the theoretical and the evidence-based research behind these self-help groups. I had mentioned CBT and REBT, but that's just kind of the tip of the iceberg. A lot of these self-help groups are really steeped in some pretty intensive therapies, which is really important, and obviously is what builds credibility for these self-help programs as well. The self-help programs, they're going to have a varying focus. They'll incorporate many different techniques. They'll have different belief systems, and we'll look at that even between Smart Recovery and Alcoholics Anonymous. There's a lot of different belief systems that go into those two different self-help groups, and we'll have a chance to explore that a little bit. And then there are also different leaders of these self-help groups as well. One thing that I did want to mention, and I think it's worth mentioning only because there's an entire section in any library that you go to or bookstore of self-help literature. There is a plethora of self-help literature that exists out there. And these are just a couple of examples. These are by no means the most highly rated or anything like that, but I thought it would be a good way to give you a mix of just some of the variety that exists of self-help literature that exists out there. The Power of Positive Thinking is a very popular one. The Road Less Traveled by M. Scott Peck is a very, very popular self-help book that exists out there. How to Stop Worrying and Start Living, Dale Carnegie. He also wrote a book that I'm going to talk about here in the next couple slides, around the 1930s, I believe. But I'll get into that in a second. Daring Greatly. I'm sure a lot of you are familiar with Brené Brown. She has a really popular TED Talk on the power of vulnerability. She has published some literature, Daring Greatly, self-help book. I'm sure a lot of people are familiar with Tony Robbins and Awakening the Giant Within. Very, very popular motivational speaker. The Anxiety and Phobia Workbook. Learned Optimism, How to Change Your Mind, or Your Mind and Your Life, excuse me. This one I threw in here because I found it interesting, so long as you're not offended by swear words, I suppose. This book is actually pretty fascinating. I did read this one, Mark Manson. It's a different take for self-help. It's really about building self-esteem and confidence. So long as you're not easily offended, it is very interesting, and I found it, while some of these other books, I don't want to say dry, but they can be a little bit dry at times, this book will keep your attention, that is for sure. And then it kind of jumps us into the 4 books, self-help books or literature that we're going to really look at today. Celebrate Recovery. Everybody's probably familiar with this one. Narcotics Anonymous, the NA book. Smart Recovery Handbook, with tools and strategies to help you on your recovery journey. And then kind of the gold standard, the big book, or Alcoholics Anonymous in this case. So let's look at some of the history of self-help. And again, I'm going to go through this a little bit quicker just to make sure we have enough time to get through everything here. But self-help has been around for an incredibly long time, even dating back to ancient Egypt. That's where we see the Maxims writings. What these were teachings and instructions guiding people on how to live by the gods of that time. So as a way of guiding or showing a person how to live according to whatever god it was that they were worshiping. They have a variety of gods. But it was interesting that even back then we saw these kinds of self-help teachings coming out at such an early time. And that kind of brings us into ancient Greek, which was 700 BCE. This is when we see the literature Works and Days, which is better known as the Farmer's Almanac. I'm sure some people have heard of that. Made famous because of the stories of Prometheus and Pandora. I'm not going to go into I'm not going to go into all the details about that, but what I will say is a lot of that writing was aimed at educating people or guiding people on how to deal with the toil and pain that define the human condition. So basically how to survive life when dealing with what it means to be human. Very, very, very interesting stuff. And that brings us into Mirrors and Princes, which was from 800 to 1700 AD. That's the early Middle Ages through the Renaissance. What these were, it's supposed to be Mirrors of Princes. What these were it's actually a genre, a literature genre. It was a series of like textbooks that showed the king or the lesser rulers how to rule and how to behave as a king or a lesser ruler. So it's kind of like a guidebook of how to be a king or how to be a lesser ruler in this case. Very interesting. It included things of what not to do, as well as things things that you should be doing as a ruler. And then the last thing I'll say about when we talk about history is the 1800s examples in law. We started to see the word self-help emerge a lot in law in the 1800s, with the idea behind it being a person can help themselves dispute. Let me rephrase that. Referring to the doctrine that a party in a dispute has the right to use lawful means on their own initiative to remedy a wrong. So basically, they could help themselves by using the law to their advantage to advocate for themselves in setting right or wrong. So it's kind of an interesting way to incorporate self-help into law in the 1800s. But all that kind of leads up to what we call the self-help movement. And this is what we saw emerge in the 1800s and still very much exists even today. A couple authors that were a part of this movement, George Combs, advocated personal responsibility, and he really thought through self-improvement and education. A person could learn proper self-control. He's actually responsible. A lot of people call him the person who kind of inaugurated the self-help movement. He wrote the Constitution of Man in 1828. Next, you have Ralph Waldo Emerson there. He wrote Compensations in 1841. The quote from that would be, "Every man in his lifetime needs to thank his faults." So this text really focuses on looking at our past, looking at our faults, so that way we can accentuate our assets and make positive strides in our futures. Samuel Smiles then wrote Self-Help in 1859. This book has a sentence in it that kind of sums it up, and it says, "Heaven helps those who help themselves." The reason I included this book by Samuel Smiles is because that's one of the cornerstones of AA and NA, having a higher power, having some sort of spirituality that you can reach out to for guidance, with the point being that the guidance will do nothing for you if you don't do the work yourself. So you have to be willing to put in the work in order to get the reward of the guidance that you receive. And then the last one, I said we'd get back to Dale Carnegie. He wrote How to Win Friends and Influence People in 1936. This was a hugely popular book. It sold over 50 million copies. It's actually still sold today with good success. What he focused on is the link between self-confidence and success. Excuse me. Dale Carnegie failed a lot in his younger years, and he was persistent and motivated, and he built up that self-confidence, and eventually he did find success in his life. And so that's kind of the idea behind the book, how that link between self-confidence and success through self-improvement. So now that we've looked at the history, I figured we would flow right into the common self-help groups and what we're going to be, our self-help programs, and what we're going to be kind of focusing on today. First one being Alcoholics and Narcotics Anonymous. Most people are probably familiar with those. I'm sure most of us have heard of Smart Recovery too, but we'll go into a little bit more detail about it. Celebrate Recovery, and then lastly, Refuge Recovery, which is the newest of these self-help programs, but has some really, really good resources. So we'll start with Alcoholics Anonymous. Alcoholics Anonymous was found in 1935. The origins of it can actually be traced back to the Oxford group. So the Oxford group was started in 1931, and they were a strictly Christian group. They used what's called the 4 absolutes. Those are the 4 points, the main 4 areas. Let me get those out for you real quick. Those 4 absolutes being love, purity, honesty, and unselfishness. And it was those 4 absolutes that Bill W. would later, in 1935, expand upon to create the 12 steps. So you see in that next bullet point, Carl Jung, MET, and Bill W. What's interesting is the formation of Alcoholics Anonymous and how Bill W. actually credits Carl Jung as being a pretty influential piece of the development of AA. Again, I'm going to try and get through this quick, but I do want to mention this story just because I find it really interesting and it's worth sharing. And a lot of you may be familiar with it, but as the story goes, Carl Jung was working with a patient in Switzerland, and the patient was an alcoholic. Carl Jung had tried everything with this patient to no success. They had run out of options, and that's when Carl Jung had mentioned that he had heard that if somebody can go through a spiritual experience and rediscover their spirituality and incorporate that into their lives, that they can be successful in recovery. Well, this gentleman took that idea. He ran with it. He was successful in recovery. He's actually one of the people who started and was with the Oxford group in the early 1930s. And then when the Oxford group, one of the gentlemen, MET, was in the Oxford group as well, met with Bill W. and shared this history with Bill W., and that's when the formation of Alcoholics Anonymous and the huge and the real powerful connection between AA and a spiritual connection was kind of birthed out of. So Carl Jung and Bill W. actually write some letters back and forth to one another where they talk about how influential Carl Jung was in the development of AA. And if anybody's interested in reading those letters, they're pretty interesting to read them. They're not super long. If you just Google Carl Jung, Bill W., it'll be the first thing that pops up, and you can read the letters real quick. So out of that, Alcoholics Anonymous, they do use the 12 steps and 12 traditions. I'm not going to go through all of them right now because as we go through this presentation, I'm going to go into them in more depth later on. These are the 12 traditions of Alcoholics Anonymous. For anybody that wants to learn more about the 12 traditions, I highly recommend reading the book called The 12 Steps and 12 Traditions. It goes into great detail about the steps, but also goes into great detail about the traditions and the theory and the points behind all of them. So we have Narcotics Anonymous. It was founded in 1953, very close ties with AA. When AA was first created, it was men only, and it was for alcoholics only. So you couldn't have any kind of other affliction. And so what I mean is you couldn't have any other addiction, but you also couldn't have any kind of mental health issues outside of the addiction either. So, people with depression, people with bipolar disorder, anything like that were not welcome in the AA meetings in the very beginning. Now, obviously, that's changed a lot, but in the beginning, that's how it was. What happened was people who were addicted to things other than alcohol didn't have a place of their own to go to. And so that's when they created Narcotics Anonymous in 1953. And Alcoholics Anonymous allowed them to use the 12 steps as part of their curriculum, I guess. The first meetings were in California. And again, they have the 12 steps and 12 traditions as well. And you can see they're pretty much identical to Alcoholics Anonymous. Alcoholics Anonymous is a 12-step program. One other thing I will say about Narcotics Anonymous is kind of an interesting fact. In the late 1950s, Narcotics Anonymous went through a 2-month period where they actually had 0 meetings anywhere. It was completely done, and people thought that maybe Narcotics Anonymous just wasn't going to make it. What had happened is NA had kind of drifted away from the foundation that AA had established. And what I mean by that is NA was starting to take donations from different people, starting to get away from some of the spiritual components of AA. And as a result of that, we saw a real drop in attendance to the point where, again, there were no meetings for an entire 2 months in 1959. That's when the founders of Narcotics Anonymous jumped back in, took the reins again, and made it a point to make sure that they stick very closely to AA's cornerstones and AA's principles to ensure that the group could be very prosperous in the future. And again, it's today, NA has over 70,000 meetings a week in over 112 different countries. So it's worldwide, and it's a huge, huge organization. So next we have Smart Recovery. This one is newer. It was founded in 1994. They have self-management and recovery training. That's kind of the idea behind it. They advertise as not a 12-step program. They're based on sensible theory, and they use a 4-point program. That 4-point program, point 1 would be building and maintaining motivation. Coping with urges is point 2. Point 3 is managing thoughts, feelings, and behaviors. This is where we're starting to see a lot of the rational emotive behavioral therapy stuff start to come in. And then point 4, living a balanced life. So a lot of holistic practices as well. Then we have Celebrate Recovery, founded in 1991. They are more than just addiction. So if somebody's struggling with anger, codependence, physical, sexual, or emotional abuse, eating disorders, food addiction, any of that stuff, they're welcome in the Celebrate Recovery meetings. They follow very closely the 12 steps of AA. The only big difference being while AA is a higher power or a God of your understanding, Celebrate Recovery is Christian-based. So it is the Christian God, and you can see their 12 steps. They still have the 12 steps, but then they have biblical passages that kind of relate to each step as they go through it. So for those patients that are Christian and their religion is very near and dear to them, Celebrate Recovery is oftentimes a great option for them to still be able to work the steps and have that Christian component attached to it. Although AA does incorporate a lot of religion too, which we'll kind of explore a little bit. Last one is Refuge Recovery. This is the newest one. This one was founded in 2010. It uses Buddhist principles, focuses on any form of addiction. So again, it's more all-encompassing. It has the 4 truths. Truth 1 being addiction creates suffering. The cause of addiction is repetitive craving. That would be the second truth. The third truth is recovery is possible. And then the fourth being the path to recovery is available. Well, what is that path? I guess that's the next question, right? They have the eightfold path to recovery. And again, I'm not going to go into great detail about refuge recovery, but I will mention these 8 areas here. So it's understanding, intention, communication, action, livelihood and service, effort, mindfulness, and concentration, with those last 2 really being about meditation. One cool thing about Refuge Recovery's website that I will mention is that they have a lot of really, really good meditation resources available. So it's something that you could easily utilize. So now we've kind of looked at the popular self-help programs for addiction. The question is, do self-help programs actually work? We hear a lot of things about that. Obviously, it's very dependent on the individual. If the person's not motivated, they don't find that motivation, it is going to be difficult to be successful in recovery in general, unless they have an absorbent amount of accountability built into their recovery. So what does the evidence show? Success is very vague in these programs. When I was doing research for this presentation, I was hoping to provide some more concrete statistics. The problem is what success is in some studies is completely different than what success is in other studies. If a person relapses, is that considered a failure? Well, if they're in a self-help program like AA, they usually get caught with a relapse pretty quickly because of the increased accountability, and then they can get into recovery again a lot quicker. So I find that to be a success. So depending on what you decide as being a success or failure, really will change and skew the statistics quite a bit. You can find studies, AA publishes that they have a 50% success rate with it moving up to 70 to 75% after one relapse. I found studies that claim AA has a 5% success rate. So you can really find different ways to skew those statistics. What is important, though, to note, dropout rate in all those studies is very high. And then once a person drops out, we don't know if they've relapsed or not. The 2 key things, commitment to a program is very key. Going to the meetings on a daily basis, especially in early recovery, is very important. Building up your support system within these communities, within these self-help programs, is equally important. And then the last point I'll make about the evidence is that formal treatment in combination with a self-help program has the highest rate of success for long-term sobriety. That's the idea behind it. Whether it's inpatient treatment, but there definitely needs to be follow-up treatment as well, individual therapy, IOP, PHP, in combination with self-help so that they can expand their support system and probably most importantly, build up their accountability in recovery. So what are some more benefits of self-help programs? First, it increases self-efficacy. When a person first gets into recovery, the idea of not using substances for the rest of your life is incredibly daunting. I'll just be blunt. It's scary to think about. So, and it's scary to see how it's a possibility. But then you start going to these meetings, and you see people who have been there for 5 years, for 10 years, for 20 years, who continue to share, who are continuing to be successful in their recovery, and all of a sudden you start to say, okay, maybe this is possible. Right? And then you go into these meetings and you start to share about your own life, and you're building self-confidence. The whole idea behind it is each time you share, each time you listen to somebody else share, each time you are accepting a feedback, you're building that self-efficacy, that belief that, okay, maybe I can do this. Maybe I can make it in recovery. And then you improve your support system. Anytime you're going to these self-help groups, you're going to be able to improve your support system. Increase accountability. I would say this is essentially one of the most important benefits of self-help programs. Anything a patient or client can do to improve their accountability is so important in recovery. The more accountability you have, the less likely you are to relapse. That's what a lot of the research shows. And so anyway, by maybe getting a sponsor who can help hold you accountable, making commitments to chair meetings or to be a speaker, all those things are ways in which a client can increase their accountability and help maintain the sobriety as a result. This, of course, decreases the likelihood of relapse. This will avoid isolation. We know that in early recovery, isolation can be one of the biggest things that can lead to a relapse. The self-help programs will allow a patient the opportunity to avoid that isolation by forcing them to go and engage with peers in a safe setting. Also, it allows you to relate to others in a non-judgmental environment. You can gain new perspectives. And then lastly, you'll learn a lot of psychoeducation about the disease in these self-help programs. There's some of that in AA. There's a lot of the psychoeducation components in SMART recovery that we'll hopefully have time to look at here today. So those are all the big benefits of the self-help programs. But the question is, as a clinician, how do we incorporate self-help into our therapy with the clients that we serve? Well, we're going to look first at Alcoholics Anonymous, Narcotics Anonymous, and Celebrate Recovery. They're all centered around, all three of these, since they all use the 12 steps and 12 traditions, we're going to link them all together here. They're all centered around cognitive behavioral therapy. So what I mean by that is a lot of talk therapy. We're identifying troubling conditions. We're gaining awareness of thoughts and beliefs about these problems or conditions. We're identifying the negative and inaccurate thoughts. Then we're reshaping this belief system and hopefully seeing the new thoughts and behavior patterns emerge as a result of that. So what we'll do is we'll go through each of the 12 steps. We'll look at the CBT component to it and kind of the goal of each of those steps as we go through it. So the first step being, step one, we admitted that we were powerless over alcohol and that our lives had become unmanageable. The main idea, component for CBT behind this is acceptance. So we accept the compulsive nature of the disease, we recognize its symptoms, and detail the costs and consequences of our addictive behaviors. Breaking through denial is basically what we're doing in this step, and that's it. We get a lot of patients who come in who can claim, or who attempt to claim, I'm not an addict, I don't have the disease. Step one, and the CBT component to it, is all about breaking through that denial and getting them to a point where they're accepting of the disease, fully accepting of the disease. And what I mean by that is that if your drug of choice is alcohol and you plan on going home and continuing to smoke marijuana, that's not doing a step one. That means you haven't made it through step one yet. You still haven't accepted the fact that it is a disease and that it will lead you back. Smoking marijuana or using any of the drugs will lead you back to your drug of choice, or you'll substitute for that drug. So step one, all about diagnose and gaining insight into the fact that you are an addict. One way, as a therapist, we see this is through a couple different assignments. The main one being kind of a real thorough inventory of how your addiction has affected your life in different components. So you can look at family life. You can look at your occupation. You can look at hobbies. You can look at life satisfaction. And you inventory all the ways in which your addiction has affected these areas, and then you can review it with the therapist. And as you review it, hopefully it starts to set in. You start to see it set in, like, okay, I can now clearly see all the areas of my life that have been, and all the ripple effects from my addiction that have gone on in my life. And you start to see the person break through that denial and get to a point where they are more accepting, hopefully fully accepting of their addiction. So we move on to step two. Came to believe that a power greater than ourselves could restore us to sanity. And this is the fun step where we lose all of the people who either don't have a higher power or who have distanced themselves from their belief in a higher power. And then this is where you get a lot of the pushback and the resistance to AA, specifically AA and Celebrate Recovery, because it says a power greater than ourselves. Well, does that mean God, or what does that mean? For CBT, we can remove the higher power component completely and look at it from a different perspective. We're looking at changing the belief system. So we're recognizing the old belief system and replacing the new belief system. What was the belief system that we had when we were in active addiction or prior to developing the active addiction, and how can we replace that old belief system with a new belief system that's going to better suit us for recovery. Kind of summed up like this: we create a new vision of life, replacing the belief system we developed through our addiction with a positive belief system to help us experience growth in our recovery. So if a person or if a patient's really against the idea of a higher power, it's very easy to work this step without mentioning higher power at all, and that's completely fine. A belief or not a belief in a higher power should never be a reason for a person not to honestly be able to work these 12 steps effectively. So we look at step number 3, made a decision to turn our will and our lives over to the care of God as we understood Him. So this step's all about a commitment to guidance and with the goal of making an acknowledgement. This is the last step before we start doing a lot of the real tangible cognitive behavioral therapy, looking at irrational beliefs, maladaptive behavior, all that stuff. This is the step where we're saying, in order to continue and in order to make this worth it, you have to be willing to commit to the work that goes into working the rest of these steps. You have to be willing to have the motivation and the drive to honestly, that's the key word, honestly work these steps when you're doing the inventories and everything like that. Because if you're not willing to put in that work and you're not motivated to do a thorough and honest job, put forth the efforts that's required, then oftentimes you're going to result in a relapse pretty quick. So step number 3 is really about saying, I'm no longer the center of the universe. It's no longer all about me. I cannot do this all by myself. I need to accept the help of my therapist. I need to accept the help of my support system, and I need to be willing to put in that work that it's going to take to be successful in this program. So the goal is just making an acknowledgement of I'm willing to put in that time and work. So here we go with step 4. We made a searching and fearless moral inventory. So for CBT, this one's pretty easy because we're listing out the thoughts, the feelings, and the behaviors. We're recognizing the development of the addiction. So we're looking at all of our negative thoughts, feelings, and all of our maladaptive behaviors, and we're making a very detailed list of all of these thoughts, feelings, and behaviors and the effects that they have had on our lives and the people around us, the ripple effects of our addiction. One of the ways it can be summed up is we comprehensively list our problematic thoughts, feelings, and behaviors that are part of our condition. So again, this all goes into recognizing the link between our behaviors, our thoughts, and our feelings to the addiction. Not using substances, if that's the only change a person makes is to just stop using substances, then they're destined to relapse. It is a personality change that needs to take place. It means we need to rethink how we went about our lives as a whole. Everything from our thoughts to the way we behave. And if we can start to really understand that as a patient, if I can start to really understand that and really strive to inventory all of these negative behaviors, then it's a lot easier to see how I can make the changes necessary in my life to be successful in recovery. For a person who just stops drinking or just stops using drugs, that's what we call just white knuckling it. You haven't put in the work yet, and you're either going to live miserably or you're going to relapse pretty quick. Recovery takes work. The goal as a clinician is to make sure that we're helping with that motivation and helping them with that guidance that they're going to need, but they're going to have to put in the bulk of the work, of course. So then we move into step 5, admitting to God, ourselves, and another human being the exact nature of our wrong. All this is, again, it's easy to remove the God component if somebody is uncomfortable with the word God. CBT technique, share and avoid internalizing. So we're getting away from keeping those thoughts inside and locked up. We're starting to be more comfortable. As a patient, I'm starting to get more comfortable opening up to a therapist, opening up to my support system, opening up in meetings, and sharing what's going on the inside. So we start that process by sharing that list of thoughts, feelings, and behaviors. Hopefully it's incredibly detailed, and it's easy to identify all of the negative, irrational thoughts, and maladaptive behaviors that exist in my life. And again, this all goes toward recognition and development, but it's also really, really important practice at this point, so that in long-term recovery, they continue that process of opening up and sharing and avoiding the internalization that can keep them sick. So many patients that come into treatment have such strong, thick barriers that they don't want to open up, they don't want to share, they don't want to talk about the things they've done in the past, and they just want to carry that burden with them because that's what's comfortable. Opening up and sharing is very uncomfortable at this step, and as a therapist, we're trying to say, I understand that it's uncomfortable to share, but this is what has to happen in order for you to grow and in order for you to be successful in recovery. And so we're challenging them a lot. And if they don't get completely honest when they're sharing their inventory, we're going to challenge them on it. We're going to ask them about different things that we know about and see if they'll start to really open up and share some of those deep, dark things that they've been hiding away for so long. And again, this goes toward the goal of recognition of development of the addiction. So in step 6, we're entirely ready to have God remove all these defects of character. So through steps 4 and 5, we've created the list of negative thoughts, beliefs, and behaviors. Step 5, we shared them. Step 6 is we're starting to replace them. So now we're identifying ineffective character traits and coping mechanisms. So what are the things that didn't work that we were using to cope with our lives in active addiction, and how can we change them for more effective coping skills? I always like to point out, at this point, patients that come in who are using what we call ineffective coping skills were most likely using coping skills that allowed them to survive for as long as they have through their active addiction. And so it may be for each patient, that's what they needed to do in order to survive their addiction. But now that they're here, now that they're in treatment, those old coping mechanisms aren't going to work in recovery. And so we have to find new effective coping skills to combat all the triggers and cravings that we're going to experience as a result of being in early recovery and even long-term recovery. And then the same with the ineffective character traits. So, dishonesty, selfishness, all those things, we'll be able to inventory them and then identify how can we work on those to make sure that we're being more honest, we're being more unselfish in our lives moving forward. So again, the goal of this one is identify and alter psychological traits. And then we move into step 7, humbly ask God to remove these shortcomings. This is where we actually jump into a lot of the cognitive behavioral assignments. The real common cognitive behavioral assignments that we use oftentimes. So we have positive self-talk, increasing the ability to increase our self-worth and our self-efficacy. So assignments like making sure that you're giving yourself, the patient's giving himself a positive affirmation in the morning and in the evening, right when he wakes up and right before he goes to bed. Listing an emotional list throughout the day. So at what times of the day are you feeling more down? At what times of the day are you feeling more energetic? Is there a link between that? Is there something going on? Identifying triggers. As you go throughout the day, what are some of the things that you're finding that are triggering you? Is it particular times of day? Is it particular people? Is it particular situations? What is it that you've identified as being triggers in your life? And again, with the goal of this one, we're looking to identify and alter psychological traits. And when we get through, I believe we're going to send the PowerPoint out. When we send the PowerPoint out too, I'll be able to send up a list of a lot of the cognitive behavioral assignments, a list of some of the common cognitive behavioral assignments that go along with this step. So step 8, made a list of people we had harmed and became willing to make amends to them all. This is a very difficult step for a lot of people. This is why this step's so far down the list. As a clinician, this is when you dive into looking at all the real big ripple effects of our addiction, or of the patient's addiction. So what have been the consequences of the addiction? What has the patient done? How has he hurt other people? How has he lied to other people? Has he abused other people? Has he or she, anything in terms of damage done to active addiction? And this can include things like occupation too. Have you lost jobs? Have you lost interest in hobbies? What are all the damage? What is all the damage that has taken place as a result of your addiction? All we're doing at this point is inventorying it. And that's a great assignment. Step 8 assignment is incredibly impactful, especially since the next time you meet with them, you'd be able to review that step and make sure that they're able to process all of that damage in a very healthy way. The reason a lot of people have trouble with step 8 is they write out the list of damage that they've done. It's going to bring up a lot of shame and a lot of guilt, and then they never process that list with anybody. So it is very important that if we're going to ask patients to create this list, that we're also making sure that we go back and we review this with them, and we talk about the guilt and shame that's associated with a lot of it. And we talk about the pain that it causes the patient, and then hopefully find some resolution to that as well. So we're looking at this point. At this point, we're looking at behavior change. Step 9, make direct amends to such people whenever possible, except when to do so would injure them or others. Again, this is when we look at more behavioral assignments, and we're looking for the idea of behavior change. So step 8 is about reviewing the damage done and inventorying it. Step 9 is all about when we have that, we inventory it, we start to experience all the shame and guilt as a result of it, or pain as a result of it. Step 9 is now about lifting that shame and guilt, lifting that pain. More importantly, is what the big book says, lifting the burden from us. We no longer have to carry the weight of all the stuff that went on in our addiction with us anymore. This is our way to relieve ourselves of all that weight. And as a behavioral assignment, one of the things we can do is challenge our patients to come up with how we're going to lift that weight from our shoulders. So when you make amends to people, how are you going to make amends to this person? The big book has a number of different ways in which a person can make amends, either direct amends, living amends, amends in kind, amends to those that cannot be seen. So one of the popular exercises for step 9 is a letter writing exercise, where if you've wronged people in the past, writing a letter to that person, not a letter that you necessarily have to send to that person, but a letter that you can get out all those emotions, all those feelings that you have built up inside you, and then you can share that letter with your therapist. And then you can decide if you want to bury the letter or if it would be appropriate to send the letter, whatever the case may be. But those can be really powerful assignments and exercises at this stage to help the process of getting the patient to free him or herself of this burden that they've been carrying for so long. The idea behind it, again, is behavior change. If a patient was incredibly dishonest in active addiction, when they do the inventory and they start making amends, they are having to practice brutal honesty when they do that amends process, right? So they're replacing the old thoughts, feelings, and belief systems of being dishonest with this new, and they're practicing it, this new trait of being brutally honest in their lives. And that's such an important correlation to make. It's not just saying, okay, we need to change the behavior. It's looking at each behavior. What are we changing it to, and then how are we going to practice it so that behavior change becomes a more concrete change in our lives, because that's how it's going to stick in long-term recovery. Then we have step 10, continue to take personal inventory, and when we were wrong, we promptly admitted it. This is Albert Ellis's ABC model. Again, most people are probably familiar with the ABC. Activating events, belief system, belief about that event, and then the consequence as a result of that. So this is all about staying up to date and not allowing the patient, or if I was the patient, this would be me not allowing myself to build another mountain of problems in my life. So when I do something wrong, or I say something wrong, or I make a mistake in recovery, I stop, I challenge the belief, or I think about how I could have done it differently, and then I make amends in the moment instead of allowing instead of allowing more things to pile up on top of it. This creates a lot of accountability, and more importantly, it helps us maintain our recovery. So again, instead of building more problems that can escalate and grow and grow and grow, we have a small problem, we're solving it right then, we're making amends for it right then, and we're maintaining our recovery so that we have more longevity with that. And Albert Ellis' ABC model is very popular for that step. As a therapist, we can show and educate the patient on how to use this model to challenge these beliefs. The last two steps, sought through prayer and meditation to improve our conscious contact with God as we understood Him, praying only for knowledge of His will for us and the power to carry that out. This is all about meditation and additional holistic coping strategies. So this is where you really individualize your recovery. What are the coping mechanisms? What are the strategies that I have in my recovery that are going to work when I find myself in a crisis, or I find myself dealing with a significant craving or a tragedy that occurs in my life, or whatever the case may be. Meditation, for a lot of people, is a wonderful way for them to find their serenity. For some people, meditation isn't as effective, or they don't want to put in the work it takes to practice that, which is fine, because there's a lot of different coping skills that you can use. I'll be a little self-disclosure here. If I'm feeling a certain way, or I'm stressed out, or I feel like I need a break or something, I'll open up a Harry Potter book and I read 15 minutes of that, and I kind of escape into a fantasy world, and then I forget that I was feeling triggered, I forget that I was feeling stressed out, and then I can move on with my life. So it can be really anything. You just have to find out what works for you, or you have to help that individual, the patient, find out what works for them, and then make sure that they're using it and incorporating it into their recovery. Sometimes it's so easy to get angry and sit there and stew about it and forget that I have 5 coping skills that I came up with to deal with this anger in an effective way. And so just constantly reminding the patients and practicing these coping skills is incredibly important for one, accountability, but also being able to continue to maintain our recovery. Step 12, having had a spiritual awakening as a result of these steps, we tried to practice these principles in all of our affairs. Helping others will help ourselves, kind of the idea behind this. And again, it goes toward accountability and maintenance. If I want to make sure that I'm doing every single thing I can to help my recovery, then giving back is a really powerful way to do that, because it does fill you with a sense of purpose. It makes you feel good when you help other people out. Every time I share with somebody, I know that that person's hopefully benefiting, but I also know that I'm benefiting from knowing that somebody's hearing me. So it's kind of mutual in the fact that everybody's getting something out of that process. The last thing I'll say about step 12 is if you haven't done a good job of some of the earlier steps, breaking through that isolation, breaking through the barrier that a lot of patients have put in place, then helping others is going to be a really difficult step. Because it's a lot easier to go into an AA meeting, say, and sit in the back and never talk to a single soul and leave 5 minutes early than it is to go in there, put your hand up, introduce yourself, tell your story, and hopefully help a lot of other people in the room. So that's one of the areas in which we can really start to challenge the patient. Hey, I want you to make it a point to speak up in every group at least once that you go to, or I want you to make it a point to show up 15 minutes early to an AA meeting and make sure that you're talking to people. I want you to be able to report back how that conversation went. Little things like that can go a long way in breaking through a lot of those barriers. So those are the 12 steps. And that's how we, from a cognitive behavioral point, that's how we can kind of incorporate them into actual therapy, one-on-one therapy or group therapy for that matter. One interesting thing I find, and I'm going to go through Smart Recovery a little quicker, it's a little easier to get through, and I'll explain why in a second. But one thing I did want to say about the steps before I do that is a lot of therapists who aren't as familiar, and they may have an understanding of the steps, but they aren't as familiar, they can't make these links real easily, will work with a patient for 9 weeks or something like that, and not realize that they've actually walked a patient through a huge portion of these steps, because they're not linking the steps to the practice that they've been doing with, or the work that they've been doing with the patient. And if we're able to link those steps to what we've been working on with the patient, it actually provides the patient with a lot more motivation and a lot more drive to continue the work in these meetings outside of treatment, outside of the work that they do with you on an individual basis. So I find it important and effective to really try and link the work you're doing with them to some steps that you're doing, if you can, if it's possible. Because again, anytime you can make that connection, I think it can be real powerful for the patient to see, especially if they come into treatment and they say, nope, I'm not doing the steps, I'm not doing 12-step work, it's fake, I'm not doing it, it's not for me. You work with them for 9 weeks, you get done and you say, well, you said you weren't going to do it, but we actually worked through 10 of these steps. So maybe you should think about incorporating them because you see how productive it was for us to do this therapy. Well, the steps are going to be there to offer that for you. So that can be kind of a way to incorporate it. So integrating smart recovery into treatment. Smart recovery is all about rational emotive behavioral therapy. It's action-oriented to better manage cognitive, emotional, and behavioral conflict. It focuses on how a person thinks about events, examine and challenge unhealthy thoughts, and it focuses on attitudes, unhealthy emotions, and maladaptive behaviors. And then like CBT, its aim is to reformulate these maladaptive behaviors into more positive ones. So to use the 4-point system, which I went over earlier, the reason I'm going to go through this really quick is because since smart recovery is so based in rational emotive behavioral therapy, their resources on their website are unbelievably valuable. They have available to everybody all of the worksheets that can be used as assignments for all of these REBT foundations. So smart recovery is very easy to find. We'll include the link when we send it to you guys. But building and maintaining motivation, which is point 1. You look at for REBT, you're looking at hierarchy of values. You look at what you were doing versus what you could be doing. Goal planning, and you're even getting the pros and cons lists. And you can look at the benefits of utilizing these lists, not just for recovery, but also for problem-solving strategies. Point 2, you're coping with urges. So you're looking at your belief system, and just like CBT, you're starting to, or just like AA, you're looking at your belief system when you were in active addiction and how that belief system needs to change for recovery. You look at triggers. There's some really interesting resources for tracking triggers and handouts for tracking triggers. Distracting and coping, and then they use an ABC model as well, which can be very effective in challenging those irrational thoughts in terms of urges. Point 3, we have managing thoughts, feelings, and behaviors. Unconditional acceptance. We look at rational versus irrational beliefs. And we're looking at how we can exchange. How can we incorporate a more rational belief system. This goes, as a therapist, this is really important. Again, we're challenging the patients constantly on the irrational beliefs and getting them to see why those thoughts can be irrational. Hopefully they can come to see that through talk therapy or motivational interviewing, but kind of the goal with that. Managing feelings, again, crisis, what do I do? What does the patient do when in crisis? What are the resources he has available to them? Things like that. Problem-solving strategies, and then relapse prevention is a big part of smart recovery, and there's some good worksheets for relapse prevention. And then the last thing for point 4, living a balanced life. So they emphasize the importance of making sure that we're balancing our interests with our mindfulness, that we have long-term goals, and then we're not just addressing our addiction, but our health as a whole. So physical health, mental health, spiritual health. What are our hobbies? What new hobbies can we explore? What does our support system look like? Are we getting stressed out at work? What can we do to cut back on that stress? Are we spending enough time with family? You look at all these things to make sure that your recovery comes first, but you're living a very balanced life, and you have life satisfaction that can provide you the opportunity to develop a long-term recovery for yourself. So those are the 4 points of smart recovery and kind of the REBT foundation behind all of them. Last thing, I only have 1 minute, so I'm going to jump through it real quick. Stigmas associated with these self-help programs. Religion is always the big one that seems to pop up. Again, I challenge everybody to say you can work an effective 12-step program without any religious component at all. Atheist AA meetings exist. They can go to those ones if they don't want to. Oftentimes it's a cop-out or kind of a way to skirt having to put that in, and they really just need to find more motivation to be able to take part in that. Some people look at self-help as a weakness. I say anybody who can develop and maintain a healthy recovery is very courageous, and it takes a lot of strength and a lot of really, really outstanding positive attributes. So it's not a weakness by any means, and we can challenge them on that. Some patients are stuck in that control aspect of it, and it just takes really thorough working through step one and saying, steps 1, 2, and 3, I'm not the center of the universe. And then if we can work through them with that and get them to understand that, and they see the ripple effects of their addiction, oftentimes they'll move through that. Labels, there's always still a label attached to people in recovery. Again, they're afraid that they'll be seen out in public or out at a meeting. If you see somebody you know at a meeting you didn't expect to see, they're probably there for a reason as well. And remembering that we have to put our recovery first is what's most important. Stages of change, trying to move, some people come in with that pre-contemplation, working a real thorough step one to get them to see the effects of their addiction and oftentimes move them into contemplation or even preparation. And there's a couple of things I hear. Statistics show they don't work. Well, we already talked about how statistics can be very flawed and it fluctuates from person to person. People will say they just don't work for me. Again, I look at that as a cop-out, as a person who's never really tried. And I challenge them to really put in all their energy before they make a decision like that. And lastly, I don't need that in my recovery. And anybody who says that to me, I always remind them that in recovery, it takes a lot of work and it's not very easy, and they need to use every single tool available to them to be successful in recovery. So that's kind of some of the common stigmas that I see. There's plenty more, but they're usually all pretty easy to confront and to get through with any of the patients. And that is it. That is everything. And I finished a minute late, and I apologize. But oh yeah, let me get through this.
Okay.
These are just the references here at the end.
Great. Well, just thank you so much for joining us today. Appreciate you taking an hour out of your day to learn a little bit more about incorporating self-help into treatment. And we will be sending out the presentation in a thank you for attending email. So watch for that, and then any of the other resources that Philip mentioned, we'll go ahead and send those out also. And I hope that you are able to join us for another webinar. We really do appreciate you and you taking your time. So have a great rest of your afternoon. Take care.
Thank you.